One of the things that always hits the top of my mind when it comes to hospitals and healthcare security is how incredibly dynamic the ecosystem is. We have employees and staff, we have contracts, patients, we have vendors that are coming in, we have emergency responders. They all need access, and often they need access right away. So as you think about this dynamic environment for healthcare security, what are some of the common blind spots or risks that you see the security teams either underestimating or not even thinking about?
That's a loaded one, but that's a good one. If I had to hone in on something you said, Will, I would probably say underestimate in security. They underestimate how much can be done with integration and automation. You listed out how dynamic and the sheer number of identities to manage physical access to in a hospital. They just accept that it's tough, it's onesie twosie, we're going to do it. And it doesn't have to be. So if I had to answer, I would say they underestimate the integration and automation that could save their organizations money and then also allow the various security teams to do what matters most, which is out and about, greeting, preparation for whatever they need to do when it comes to an incident, and not worrying about badges, taking badges away, giving badges, and being able to give physical access to all these different people. Most of them have reached a point where will our employee, we can get him pretty smoothly in the system. Onesie twosie after that. Will transitions from nurse to doctor, somebody typically still has to go in and adjust all that stuff. So that's there, and it's a necessary evil. Of course, we can improve upon that, but most of them will accept that. What I think so many of them don't know, and I literally see the eyes get big when I talk about it, they don't know that they don't have to manually manage all those contractors.
Interesting.
And so think about contractors as in, this is Will from IT. He's going to be here for 3 months to help us with this upgrade. That can be automated with the database. Contractors also in the form of Will that works for the janitorial service. They're there in the hundreds, sometimes thousands, but they are not our employee. Integration and automation can absolutely smooth out all of that stuff. So going back to what you said, what do I think they underestimate the most when it comes to the access of all those different physical identities and personas? Probably the role of integration and automation.
So if I hear you correctly, you're saying they get so used to the manual process,
Absolutely.
they just accept that as the reality and that there's
Absolutely.
no other way. But once you open their eyes to the fact that automation can remove those manual processes, seamlessly integrate between external and temporary employees, contractors, visitors, their whole world expands. They're able to see the light in terms of putting that process and automation in place. And I'm assuming that also then helps them with compliance as well, right?
Absolutely. With governance and compliance, there's organizations that don't pass their own internal audit. You know what I mean?
Wow.
So we're not going to even get into GRC that could come down from governing bodies. We're talking about internal audits. Some of them do not pass because it is such a monumental task. Some of them are disparate access control systems. You don't find that as much in the industry as we did before. It is absolutely par for the course to have someone in a basement managing an email inbox of access changes, and this is what they do 5 days a week. They've just come to expect that, and they're not aware that it doesn't have to be that way. It hasn't bubbled to the surface the risk involved when that person is done on Friday and there's no access changes taking place until they come back on Monday. Because anything that happens as far as access changes, it's manually done and managed via an email inbox. And that is not an example that's reaching. That is a very common example.
It's interesting. So it sounds like there's a lot of opportunity for people to learn a better way. And you had said something earlier in your answer that kind of stuck out, where you had mentioned the fact that through this automation, through this integration, the security team can now get more time to do the things that they actually want to do in security. Maybe that's the thing that helps convert people over to say, why am I stuck doing administrative staff when my mission is to secure and to keep people safe?
So a lot of times security personnel in charge of badges, and those that are really behind and they're doing things that are form-based. Simple example, I come off the floor, I'm probing the ED, that's part of my guard post. Nurse Susie forgets her badge. I have now left the ED. I've gone in the back, get her form. I'm going to log into this system and this one, get her a temp badge. But now I'm not where I need to be, which is in the ED. Super important role. They're not people hired expressly for that purpose. They're multitasking. These are people that came here to be security professionals. They came here to be people that are going to greet and also be prepared to handle incidents. And now they are taking in forms and issuing out lost badges and things. There's absolutely a better use of their time.
It changes the way that security should look at access and access control, access management. I was having a conversation back and forth on LinkedIn for a post, and it was talking about the fact that we need to pivot in access control from just managing credentials to managing identity. And that identity is now the center of access, meaning it's no longer about what credential I have, but who am I and should I be there? And that the automation of all of that changes access. If you think about the business case for a hospital, they have to choose among a lot of different initiatives for security every year as their budget comes in and out. What's the business case here in terms of looking at automation, looking at identity as the core and managing that both from an employee, staff, as well as contractor and visitor?
It is absolutely an issue in healthcare to be able to get this to rise to the top of all the initiatives that are coming forward. There's a going joke in healthcare that you're always up against the MRI machine. When that MRI machine is going to make $1 million a month or a week or whatever that is. But here comes Will asking for a new camera. One thing I heard that I would love to get out to as many healthcare security professionals as I can, and I wish I could remember that gentleman's name, but it was a keynote speaker at a healthcare security event. He said, go into your presentations with a cost-saving initiative. Not, here's my new security toy, here's what I need to make it safer. That stuff obviously is important, but when it comes time to make this a priority, a business enabler, something that makes sense to the business, this cost-saving initiative. Now we back up to, what does that mean for PIAM? There's an ROI that comes with that. Maybe we now, instead of having this lady that manages a 400 email inbox per day, that's an FTE that could be on the floor. You know what I mean? There's an ROI that comes with Dr. Will waiting 3 days to get his ID because we printed it here. We have to get it to him at his hospital across town. We use a third-party delivery service. These things I'm telling you are not far-fetched, Will. This is really what's happening out there. There's a cost associated with having to escort Dr. Will around because his ID wasn't ready in time. How much does Will make an hour to stand there and kick out IDs? So there's absolutely an ROI. And going back to what you said, well, how do we begin that process? How do we hope to win out? Begin with cost savings initiative. Begin there, and then they can begin their pitch into what it is that they want. But there's absolutely an ROI, especially when it comes to managing all those identities we talked about.